If you haven't heard about this yet, you need to pay attention. A rare and deadly virus is making headlines across the world, and after everything we went through during COVID, this is the kind of story that immediately raises alarm. It's called hantavirus. And right now, a cruise ship named MV Hondius has become the center of a global health scare after multiple passengers were infected and 3 people died because of this virus. So what exactly is happening, and should the world be worried? Let's start with what hantavirus actually is. Hantavirus is not a new virus. Scientists have known about it for decades, but unlike COVID, it does not usually spread from human to human. Instead, people get infected when they breathe in tiny particles contaminated with rat or mouse urine, saliva, or droppings. In simple words, dried rodent waste can turn into dust, and if you inhale that dust, you can become seriously ill. There are several strains of hantavirus. In Europe and Asia, some strains mainly damage the kidneys. In North and South America, certain strains can attack lungs and can cause severe breathing failure. The strain involved in this outbreak is called Andes virus. This is the only known hantavirus strain that can spread from one human to another, but only after very close and prolonged contact, usually between spouses, family members, or healthcare workers. Now here is how this outbreak began. A Dutch couple spent months bird watching across South America, including Argentina, Chile, and Uruguay. Health investigators believe they were exposed to infected rodent droppings in Argentina. On April 1, they boarded the MV Hondius with passengers and crew from more than 20 countries. At the time, they felt completely fine. That is one of the most dangerous things about hantavirus. The incubation period can last up to 6 weeks, and in some reports even longer. That means someone can carry the virus for weeks without knowing they are infected. Days after boarding, the husband developed fever, headache, and abdominal pain. He died on board. His wife later became ill and died in Johannesburg. Other passengers also started showing symptoms. According to the World Health Organization, 8 cases have been identified so far, including 3 deaths. 5 cases have been laboratory confirmed, while 3 remain suspected. Symptoms usually begin with fever, headache, muscle pain, nausea, vomiting, and stomach pain. In severe cases, fluid builds up in the lungs, making it extremely difficult to breathe. What made this outbreak particularly alarming is that some passengers had already left the ship before the virus was identified and traveled to other countries. That triggered international effort to trace and monitor those who may have been exposed to the virus. Now the big question, is this another COVID-19? According to the WHO, the answer is no. WHO has clearly stated that while more cases may still appear because of the long incubation period, the overall public health risk remains low. Unlike coronavirus, hantavirus does not spread easily through casual contact. You are not likely to catch it by simply being near to an infected person. Still, this incident is a reminder of how a little known virus can suddenly put the entire world on alert. And in post-COVID-19 era, even a rare outbreak on a single ship is enough to capture global attention.